Welcome to the interview. This is going to be an Oxford-style interview with a third-year Cambridge medic.
Hello.
And I've co-authored a medical book myself. So, this is going to be on the topic of the nervous system. Let's go ahead.
Okay, so what do you know about the autonomic nervous system? What would you say, what are the two branches of it?
The two branches are the parasympathetic nervous system and the sympathetic nervous system.
Okay, so what do they control? What do you know about, let's say, neurotransmitters, if I said that?
Okay, so they control unconscious movements. So they would control certain pathways, like maybe the motor pathway on the unconscious side, and other things like breathing, heart rate, all those things. And neurotransmitters are simple molecules that bind to certain receptors on the membrane of neurons, which allow them to activate certain receptors to open channels which allow for ions to move across the neuronal membrane.
Okay, just they'll clear up. So they don't actually, like, the autonomic nervous system doesn't control movement, but it does control muscles. So smooth muscles, not skeletal/striated muscle.
Okay.
So, but yes, you're right in that they do control kind of these homeostatic mechanisms like breathing, heart rate, so forth. So, do you know what the neurotransmitter would be for the sympathetic nervous system?
No.
Have you heard of noradrenaline?
Yep.
What kind of neurotransmitter would you say this is?
Excitatory.
So what about the neurotransmitter for the parasympathetic nervous system?
Maybe acetylcholine.
Yes, and do you know kind of what receptors, let's say noradrenaline or acetylcholine, act on? It's okay not to know.
Okay. I've heard that they might act on muscarinic receptors.
Okay. If you look at the diagram, have you heard of any of the receptors on the board?
No.
Okay, so adrenaline, noradrenaline, they activate alpha-1, alpha-2, beta-1, beta-2, and beta-3 as well. Adrenergic receptors and muscarinic receptors are the ones that are activated by acetylcholine. So could you maybe go through, let's say, heart rate? What would be the process of how the autonomic nervous system would act, would you say? What are kind of the things that you need to have to control this homeostatic mechanisms of elevating or decreasing your heart rate? So I'll start off with first saying that you have baroreceptors that detect pressure in, let's say, the aorta. It doesn't matter. What would you have to control this system? If we have, let's say, you have an increase in pressure, which is detected by these baroreceptors. Where would these go? Please use the diagram to help you as well.
Okay. An increase in pressure would be
what would detect it?
the baroreceptor.
Where would that signal go? You have an increased rate of firing the baroreceptor. Where would that go?
It would go to the heart. So,
no. Have you heard of what controls? What's a higher order system that controls heart rate, breathing rate?
Oh, the brain.
Which part of the brain? Have you heard of the medulla oblongata?
Yeah, I've heard of that.
Okay, so that is really one of these big autonomic relay stations that is controlling a lot of these baseline functions. Obviously, it does have higher inputs as well. So these signals go into the medulla, where you have an increase of pressure detected in the heart. So then, what will be the downstream effect from the medulla going down into the heart tissue itself? Okay, let's look at this. So you have the two output pathways from the medulla, the sympathetic or the parasympathetic nervous system. How do you think each of those would affect the heart rate? How does the sympathetic nervous system affect the heart rate? It would release noradrenaline. Do you know which part of the heart it would release onto?
Well, it would ultimately want to release it in a way that it would affect the SA node. in the
Yeah,
heart.
so you release noradrenaline from your sympathetic terminals onto the SA node.
Oh, directly, okay.
Yes.
And
What about the parasympathetic nervous system?
Oh, it would release it, I would say, onto the AV node.
It is a little bit more to the AV node, but it also releases onto the SA node as well.
Okay.
And what would you be releasing from the parasympathetic nerve terminals?
Acetylcholine.
Yes, okay. So how will the sympathetic and then how will the parasympathetic affect the heart rate?
So the sympathetic nervous system would release noradrenaline, as you said, directly onto the SA node, which would excite it and increase the heart rate. And the parasympathetic nervous system would most likely have the opposite effect, releasing acetylcholine onto the AV node and would try to slow down the heart rate.
Okay, let me just grab up a diagram while you think about what would happen if you had increased blood pressure. How would that affect the heart rate?
So the baroreceptors would pick it up and send a signal, and it would want to slow down the heart rate in order to not send too high pressure blood to areas like the brain, which it could damage.
Can you repeat that, please?
Yeah, so it would send a signal in order to slow down the heart rate, in order to not release very high pressures to areas like the brain where this high pressure blood could damage it.
And how is it going to achieve this? How is it going to affect the heart rate?
It would. So it would most likely send a signal for the parasympathetic nervous system into the medulla, which would then send a signal down the parasympathetic nervous system to inhibit the AV node to slow down the heart rate. That's the picture.
Okay, yeah, that's cool. Oh, come on. Sorry. Okay. So, if we look at this diagram here, which I've just got up, do you recognize the pacemaker potential? Have you looked at this at all? This is what's going on at the SA node. So the black line is your intrinsic heart rate. How would you think you're affecting the slope of the pacemaker potential? This is the pacemaker potential here. So if there's no resting membrane potential, how does this change from the black line to the blue to the sympathetic, and why? How is the slope changing? How is the heart rate affected by vagal and sympathetic inputs?
Okay, so by vagal input, I can see that it's increasing the intrinsic heart rate, and so is sympathetic. It's increasing the slope. That's the general picture.
Which ones? Is sympathetic increasing the slope and then vagal decreasing the slope?
Yeah, but I can't see.
Yes. So have you? Okay, yeah. So so the vagal input is decreasing the slope, and the sympathetic is increasing the slope. And what will increasing the slope mean for the heart rate?
It would increase the heart rate.
Yes. Okay. So have you heard about any second messenger systems in your studies or your own reading? Downstream effects of receptors. Anything like that? Any like cyclic AMP? Have you heard of that? Any signaling? Vague. Okay. Right, camera. Okay, I think we'll leave that there. Okay, how do you think drugs can act at these receptors? How do you think they can act in? How do you think you can control heart rate? Let's look at the sympathetic side. How do you think drugs can act on adrenergic receptors to increase the heart rate?
Drugs could adrenergic receptors. So those,
how could drugs act on the receptor? What are the basic two things that they could do?
maybe increase the ability of adrenaline to bind to it.
Okay, yeah.
And they could also stimulate the receptor.
Yes, so stimulating the receptor. What else could you do on the other side? Inhibiting the receptor. Do you know any drugs that affect the adrenergic system?
No, I think I know the class. What they do, how it's called. That's it.
Would you?
Is it known as allosteric modulation?
Yes, you can have allosteric modulators at the receptors, but that's only a subset. They'll act in different ways. You can have competitive inhibition, different things like that. How about for the parasympathetic side?
It would stimulate or inhibit the acetylcholine receptors or nicotinic receptors.
No. Actually, the nicotinic acetylcholine receptors are involved in the motor system. You can affect nicotinic acetylcholine receptors, but those are only in the parasympathetic ganglia.
Right.
Because it's in the periphery that muscarinic receptors are the output. From the central nervous system to the parasympathetic ganglia, it's nicotinic acetylcholine receptors.
Okay.
So what do you think that would be the implications of the fact that you have nicotinic receptors in parasympathetic ganglia, but also in the muscle? What would that mean if you're trying to administer drugs, let's say anesthetics or things like that, or acetylcholinesterase inhibitors?
It would affect both the muscles and the brain, and certain areas of the brain.
Well, yes, going centrally is always something that needs to be considered because there are many different types of nicotinic receptors, and some of those are found in the brain. Different subunit structures, of course. But we're just looking at the periphery here. So how, if you, let's say, if I told you that there's nicotinic acetylcholine receptors in parasympathetic ganglia, but also in motor end plates, so in the muscles, basically, the end of alpha neurons, alpha motor neurons. What would that mean if you give a drug to inhibit nicotinic acetylcholine receptor and block it for the muscle? You're trying to
prevent acetylcholine from binding, or it would simply.
Actually, yeah, sorry, I shouldn't have. Okay, fine. I'll give this example, then I'll give another example. But how would let's say the patient, let's say the person has, what other symptoms would they see? I'm probing you to kind of think about the ganglia as well as the motor end plates. So let's say I give acetylcholinesterase inhibitors.
Yeah.
That would
inhibit the breakdown of acetylcholine.
So if you have, let's say, increased acetylcholine.
Yeah.
Where would you also have this increased acetylcholine? You have it at the end, motor end plates, but you also have it in the
parasympathetic ganglia.
So if you had increased acetylcholine in the parasympathetic ganglia,
yeah,
what would you have? Would you have more or less parasympathetic signal, basically?
More parasympathetic signal.
So you'd get symptoms to do with increased parasympathetic or increased vagal tone, for example.
Right, okay.
Do you have an idea of what some of those would be? Give me a few examples.
So that would, more acetylcholine, more parasympathetic, that would affect the AV node more, so low heart rate. Would that be an effect?
Yeah, okay. What else?
Potentially fatigue, not as much blood is being supplied.
What other systems can you affect?
Muscles, organ systems as well.
We're looking only at, let's say, autonomic processes here.